Today I will be showing you how to take care of a patient with the ileostomy. An ileostomy is a permanent artificial opening on the ileum which is drained through a stroma on the surface of the abdomen. The drainage of the ileum is in the liquid form which contains a lot of highly acidic digestive enzymes, which means that the nurse should provide very excellent skin care to the patient because the skin around the stroma is going to get irritated and swollen very easily. When you're caring for a patient with ileostomy, it's very important to wear gloves so that you don't infect the patient. So before you even approach the patient, wash your hands thoroughly and put gloves on. After you put on gloves, it's important to make sure that there's a bed protector under the patient in case any contents of the ileostomy bag spill out. When you remove the ileostomy bag, it is important to remember to remove it gently so that there's no irritation to the patient's skin. As mentioned before, the ileum has the digestive enzymes which are very highly acidic, so we have to be careful to not irritate the patient's skin further. So when you remove the ileostomy bag after that, you have to empty, if it's a reusable bag, empty the contents of the bag into a bedpan, but if it's a disposable one, you have to dispose it in the appropriate biohazard waste bag. After you remove the ileostomy bag, you have to observe the contents of the bag to make sure that there's no abnormalities that you cannot see. If there are abnormalities, you should report directly to your nurse. When you observe the stoma around the patient's abdomen, you have to make note if there's any discharge, redness, swelling or smell that is abnormal coming from the patient's stoma. If there's no such smell or discharge, you can gently clean the patient's stoma with an antiseptic. Mild soap and water will also do. If you're using a disposable bag, you have to replace the bag back on the patient. So when you replace the bag, make sure that the adhesive wafer is the same size as the ostomy that the patient have. Many hospitals have a device that you can use to make sure that the size is appropriate, and then you place the appropriate sticker with the appropriate size. After that, you can replace the bag on the patient and make sure that the bag and sticker meet and have tight seal so that there's no leakage that occurs. If there's any smell and if the patient wants to do so, you can use any odor expelling agents that are available in the hospital to put inside the bag so that odors are diffused. After you're done applying the bag on the patient, remove the bed protector and dispose of it in an appropriate waste bin. And that is how you take care of a patient with an ileostomy.